everybody, it's Dr. Vinay from Northwestern Hair. It's now day 9 and we're on cruise control until tomorrow. So I want to take today to review our maintenance therapy so we can help you pick the right one, as well as start answering some questions about nutritional supplements, shampoos, conditioners, because I do get those questions quite often. So our maintenance therapies, we had 3 options. We had the topical medication, the laser cap, and PRP. The topical medications are by far the most effective and the cheapest. They're combinations of finasteride and minoxidil. Remember, finasteride is the only maintenance therapy we have that actually blocks hair loss, whereas minoxidil, laser caps, and PRP are all stimulants of hair growth. Those topicals are delivered to your house every other month, and you're gonna put them in once a day. Now, laser caps are a great convenient treatment because it's at home. It's going to use light energy to increase the metabolism of your hairs and for your body to respond with better blood flow, oxygen, nutrition delivery, so you get a better, more healthy scalp for these hairs to grow in. You're going to wear it 30 minutes, 3 times a week. It's battery powered, fits underneath the baseball cap, just absolutely convenient and practical from its sense. And then we have PRP. PRP is our all-natural option. We're gonna draw your blood, isolate your platelets, concentrate them, inject them to your scalp, where they're gonna release growth factors to stimulate hair loss. You're gonna do 4 sessions, with each session 6 weeks apart, and then you're gonna move on to maintenance treatments with PRP every 9 to 12 months. So I tell you to pick your maintenance therapies based upon how you think they're gonna fit into your life, not based upon costs, not based upon efficacy. Just pick the ones that work best for you. I highly recommend that you pick 2, and if you can, do all 3. All right, now let's talk about nutritional supplements. I get a lot of questions on whether you should be taking oral nutritional supplements for hair loss. Well, my answer is yes, you should be on something to make sure you have all your nutrients. However, most of us aren't deficient enough to cause hair loss. But if you're gonna look at nutritional supplements, this is what you want to look out for. The first ingredient is saw palmetto. Saw palmetto is probably found to be the most effective at hair loss. It's not gonna be anywhere near effective as the maintenance therapies we talked about, but saw palmetto can block the conversion of finasteride to DHT, which can impact your hairs. Now, you don't need to go out and buy an expensive hair brand of saw palmetto. The stuff you get at Whole Foods or Trader Joe's is just fine. The basic nutrients you're gonna be wanting for hair loss are actually found in a multivitamin. It's vitamin A that's normally found in hair and skin cells and also in oil glands. Vitamin B, such as biotin and niacin, which are involved with the protein synthesis of hair. Vitamin C, which is also involved with protein synthesis, which your hair is made out of. And vitamin D, which is normally found in skin cells itself. Also zinc and iron. Iron is something you might want to check if you have iron deficiency anemia, especially for a female. Those are the supplements you want. Now, there are great nutritional supplements out there. So call them Nutrafol and Viviscal. I can't even say it correctly. These are relatively expensive, but they're great because everything's in one bottle. Hopefully in the future, I'll have these in the office so you can just get them directly from us, maybe at a cheaper cost than you could online. So now let's talk about hair care, shampoos, and conditioners. Got a lot of questions about hair shampoos. Now, hair shampoos, there is one medicated shampoo out there called ketoconazole. It is found to have DHT blocking effects as well. Remember, that's the molecule that binds to your hair follicles and causes progressive uses over time. It's usually sold online for like 20 or 40 bucks a month. Now, I prescribe this medication to you before your procedure for itching. It is the same exact thing, ketoconazole 2%. Your insurance company probably gave it to you for like $4 to $5. So I wrote you a script for a full year. Utilize that before paying exuberant amounts of money online. Now, I will tell you that ketoconazole, although it does have some hair block effects, again, is nowhere near as effective as maintenance therapies, and it can be a little drying. This drying is important for your transplanted hairs. Remember, based upon the technique you chose, will determine how many oil glands got transferred with your hairs. If your hairs don't have these oil glands, they're gonna become dry and frizzy, and the last thing you wanna do is strip them further with a shampoo that it's known to be drying. So in terms of other shampoos and conditioners, we want to follow that same principle of not stripping your hairs of oils. You don't want to use an aggressive shampoo that's going to be stripping all the oil off your hair. I don't know if you ever shampooed your hair twice but didn't put in conditioner and you feel dry and frizzy your hairs. That is an aggressive shampooing. You don't want to do that. You also want to use a conditioner that adds a lot of moisture back to your hairs. So usually a thick, creamy conditioner that usually leaves your hairs with a lot of moisture. If you can find a light shampoo and a heavy conditioner, that's going to be your best option for you too. Now, when you go to the stores, what you look for is shampoos and conditioners that are meant for damaged hair. Usually color treated hair, they're going to be the most mild shampoos and heavy conditioners that are out there, and that's what you want to start using. Now, that's also when your hairs come into play. You have a year before you should expect to have new growth. That's after your new hairs come in. You have 4 to 6 months, maybe a year before you see growth, and you start worrying about your shampoos and conditioners. So hopefully that answers your questions about nutrients, shampoos, conditioners. Really look into your maintenance therapies. We're going to want to get them prescribed during your follow-up visit.